Thank you very much. I'm glad to be here. Glad to talk to you about some of our research here where we're using found geospatial data to help explain opioid overdose events. And this is a general problem, trying to find data at high levels of spatial and temporal granularities that can match the dynamics of the type of public health issues that we look at. And in this case, it's opioid overdose events. Now, I don't have to get into this too much. We heard from the previous speaker that this is still a big issue, that it's a major public health crisis in the United States. Unfortunately, I live in a state where it's one of the top ranked states in terms of opioid overdose events, and the city I live in also happens to be one of the hotspots overall at a city level for the opioid epidemic in the state of Ohio. So what we can see in this graphic here, and I'm showing you a heat map, a dynamic heat map over the years of our database, and it's of individual opioid overdose events and how they spread over time. Now, when I look at this, and I'll talk about the database in just a little more in just a few minutes, but when I look at this as a geographer, I see, and one of the first things I always do is to map the data because I want to see if there's any hypotheses that in my mind that are being supported or perhaps new hypotheses. And if this was a completely spatially random event, we would expect just to see random, like lightning strikes all over the map. Also, if it was a pure contagion effect, shall we say, which I don't think it is, it would spread out regularly from an initial point. But instead, we're seeing a very inhomogeneous spread. And it is following what are traditionally disadvantaged neighborhoods in the city of Columbus. So we're looking at this. We're looking essentially, it's a problem in looking at the neighborhood, the social determinants of this health crisis. So the problem is that we face in looking at this problem in my community, but the challenge we face is that traditional data, such as census data, is only available in spatially aggregated form, and it's only available at 5 to 10 year increments, and it certainly does not match the spatial and temporal dynamics of the phenomena that we just saw. So we search for timely, high spatial resolution data, and some of the found geospatial data we're working with right here is 311 data, Google Street View data, and the opioid overdose event database that we got from the Columbus Fire Department. What I mean by found data, you're probably familiar with the concept of secondary data, I should say, is that when you collect data for one study and apply it to another study. Found data is a generalization of that. It's a broader concept. It's the idea that a lot of urban processes now throw off data exhaust. It's data that's generated not for research purposes, but it is being thrown off by our urban processes and individual behaviors, and we can leverage this data in order to get a finer grain look at public health issues. So these are the databases that we used in this study. The first was the opioid overdose events, and that was the basis of the heat map I showed you, the dynamic heat map. And we worked with the Central Ohio Trauma System. The Central Ohio Trauma System is a clearinghouse for data on trauma events in Central Ohio. And they work with first responders and hospital emergency departments. We work with them to expand this mission to include opioid overdose events. And all of these opioid overdose events happen at street addresses in the EMS data. And we're able to geocode 3/4 of these records. I'll just comment that 73% of the opioid overdose events in our database occurred in residential locations. It comprised about a little over 10,000 records between January 2008 and December 2017. We also worked with 311 data. I'm sure a lot of people in the room are familiar with 311 data. 311 data is non-emergency requests to the city, fix the street light, there's something wrong with this park, there's trash overflowing here. In the Columbus system, it's categorized into 21 different categories. And we got the full data set going back from 2008 to 2017 from the Department of Neighborhoods, and it comprised about over 800,000 records. And then I'll talk a bit about how we brought Street View imagery into this analysis in just a few minutes. So this is our first gut check about the 311 data. We wanted to know, are there spatial associations between the type of 311 requests and socioeconomic conditions in the city? Are different types of 311 requests indications of neighborhood distress? So what we did is we first clustered the 311 requests, and we found 3 clusters, and then we overlaid those spatial clusters with ACS data, And we did an ANOVA test and found that the 3 clusters of 311 data correspond to different socioeconomic profiles in neighborhoods. And if you look in particular, I think there's a laser pointer here. The dark color here is cluster 1. That's, those were things like trash, code violations, the type of 311 requests. I'll get into that in just a little in a few minutes to say what those requests were. And that is traditionally the what we call the upside down T in Columbus. The east side of Columbus and the south side are where we see deprived neighborhoods that have suffered structural racism, disadvantage over the years. So, and again, we're seeing different profiles of 311 requests associated with those neighborhoods compared to the other 2 clusters which we found, which associate with middle class and then finally more affluent neighborhoods. And this is showing 2 years, 2010 and 2015. We're just looking to see if these clusters were stable, and they were stable over time. So what we did is we used a spatial cross-K function analysis, and we did this both at the annual level but also at the quarter level to see if these were temporally stable. They were. And basically what this does is it looks at the association between 2 point distributions in space and then looks at how over what distances that there's some kind of non-random association between them. We tested all distances from 1 meter to 3,000 meters at 1 meter increments, and we found a decay after 500 meters. So this analysis ranges from 1 meter to 500 meters. And if you look at this, you could see the type. These are all 21 of the, I think, well, you can't really see the red dots. I'll just point to this. That's the 21 categories of 311 requests that the city of Columbus recognizes. And the red ones are the ones that seem associated with opioid overdose events. And we could see things like abandoned vehicles, animal complaints, code violations, law enforcement, public health, trash, sidewalks, street lighting, street maintenance, traffic signs, and water, sewers, and drains. And what we did is we took these 311 indicators, and we also took the opioid overdose events, and we used a Geddes-Ord G statistic to find spatial hotspots and cold spots for both opioid overdose events and for these different types of 311 requests. And then I'll show you a map in just a second, but then we did use the confusion matrix to see how well the 311 requests predict the opioid overdose events, and these were the main ones that seem to predict opioid overdose events very well. This is a map, so that on the upper left there you see hotspots and cold spots for opioid overdose events in Columbus in 2017. The top 311 requests up here, code violations, public health, street lighting, those were the best predictors of those opioid overdose hotspots, and the ones on the bottom, traffic signs, street maintenance, water, sewer, drains, were the worst predictors of opioid overdose events. So we are seeing the fact that certain types of opioid overdose events are spatially associating with certain types of 311 requests, which seem to associate with neighborhood distress. So we decided to look at the physical environment as well. So we brought in Google Street View imagery, and we integrated this with the 311 data and with the ACS data to try to explain how social and physical disorder may associate with opioid overdose hotspots. So we collected Street View imagery for the entire city of Columbus. We did it at 100-meter increments along the entire street network, except for interstate highways and other types of limited access highways. We collected about 161,000 Street View images. And what we did is we did 2 types of machine learning approaches here. First, we took images from the MIT Place Pulse data set, which basically has a bunch of images, and people in a large panel around the world have classified them based upon different perceptual dimensions like boring, wealthy, beautiful, things like that. And then we segmented those images using another machine learning technique to break the image into different objects like tree, pavement, building, things like that. So we did that to train our machine learning technique on those place pulse images and the segmented objects. And then we use those trained neural networks to predict the perception of different parts in Columbus from Street View imagery that's been segmented into objects as well. Was that clear? Sorry, that was a little convoluted. Am I good? Okay. So first of all, this is a 311 request per 1,000 people, the rates, and this is showing, we classified the 311 request into indicators of physical disorder and social disorder, and this is showing the 2 years we did our analysis in this study, 2016, 2017. And we are seeing, again, if you look closely and you know Columbus well, like I do, you see the upside down T, the east side of Columbus and the south side of Columbus, and we're seeing that's where those 311 requests are concentrated. And then this is a map of the 6 perceptual indicators then predicted for Columbus. Beautiful, boring, depressing, liveliness, safety, wealth, and a little more of a convoluted pattern there, but we are seeing some spatial associations, geographic associations with traditionally deprived neighborhoods in Columbus. So here's all our variables that we put into a regression model, which I'll talk about in a second. We have the 311 data measuring physical and social disorder. We have the perceptual ratings predicted of urban physical appearance along those 6 indicators, and then the traditional ACS data, census data. And we use a negative binomial regression analysis. We considered a Poisson regression analysis, but we tested for over dispersion and decided that for this phenomenon, because of its relative scarcity, we would use a negative binomial regression. We started with the null model, the ACS model, and then we tested the 311 data and imagery data separately. And then we added in the different types of the imagery and 311 data into the base model, and then finally the fully saturated model at the bottom, and we'd see a drop in deviance, significant, and that fully saturated model was the best fitting model. And this is the results, and these are relative risk. So if it's above 1, it's a positive association. It's below 1, it's a negative association. And these all correspond to our expectations surrounding opioid overdose events as being associated with neighborhood distress. And you can see things like, boring, depressing, being positively associated, lively, safety, and wealth being negatively associated. And both of the 311 categories were associated with opioid overdose events, positively. Okay, so why these associations? And I'm going to give you a reference to the papers you can look at yourself, and I can't give justice to all the explanations we have for this. This wasn't just curve fitting. We actually have theories to describe this, and we have citations to the literature to describe, to back up some of our conjectures here. But why we see these associations are social disorganization, neighborhoods with less informal social control and support, the environmental psychology of these less desirable, less well-maintained built environments associating with depression and stress. This, of course, could be a direct effect. Also, this could be an indicator of socioeconomic status in these neighborhoods. And the physical environmental structure, fewer social contacts to avoid this is where opioid overdose events occur. They occur in places with fewer social contacts to avoid social control and enforcement of neighborhood norms and community supervision. People basically just avoiding that and where they tend to use. So just to conclude, the opioid crisis is rooted in social inequality, distress, and underinvestment, and found geospatial data, such as 311 data and Google Street View imagery, can provide additional understandings to give us insight into the social and neighborhood determinants of health disparities, including the opioid overdose crisis, and it can also guide resource allocation and public health interventions. Those are 3 papers that were published from this study. I want to highlight my PhD student, Yu-Chen Lee, who's now at Leeds University and the faculty there. I was the PI on this project, but these studies I described in this talk were basically the 3 papers that comprised his dissertation at Ohio State. Also want to recognize our partners here in Central Ohio Trauma System, Medical Center at Ohio State and the College of Public Health, and the Mighty Crow Media, who is basically working in the community looking at opioid overdose prevention, interventions, and policies. And it was funded by the Opioid Innovation Fund at The Ohio State University.